I'm Tin again, one of the chief radiology residents. Wanted to introduce you to neuroradiology. I'll be doing neuroradiology fellowship. Been spending a lot of time in this section. So come on, we're in the Smilo Cancer Center, similar to where breast imaging was. But this is the second floor. So we have multiple reading rooms here, one of which is the neuroradiology reading room. We'll show you to the right. But before we do that, we wanted to show you where all the scans, the majority of them are done, right across the reading room. Come on, let's take it.
Hi, how are you?
Good. How are you doing?
I'm good, thank you.
Want to introduce yourself?
So, my name is Marie Hausner. I'm the safety lead for MRI. This is the main Smilo area in North Pavilion. If you want to take a few steps closer. These two rooms by the windows are both 3 Tesla. And the room to the left of you is the 1.5 Tesla. The whole hospital is all Siemens, and this is the area where we do all the Smilo inpatients. We do outpatient heart stress exams, and any inpatient pacemakers from this hospital, and also St. Ray's from over here.
And how many scanners overall do we have?
Overall, we have 14 or 15. In the operating room, there's a 3 Tesla, which is on the 3rd floor. Come down to the 2nd floor, there's 3 here, a 1.5 and 2 3Ts. The 1st floor is another 3 Tesla. If you go over to the West Pavilion, there is another 3 Tesla. It's a newer model. We try to keep all the pediatric patients over there as best we can. Then across the street, there's 3 more magnets. There's 2 1.5s and a 3 Tesla over in the Fitkin area. St. Rayfield's has 2, a 1.5 and a 3T. North Haven has 2 3Ts. There's a lot, right?
Yeah, well, we see a lot of studies here.
Yeah,
so
and then
everyone busy.
And eventually we're getting a 1 Tesla in the NICU.
Oh, very nice.
But that was on a little bit of delay, so that should be coming maybe next year.
All right, wonderful.
Yeah.
Thank you so much.
You're welcome. Alright, nice to meet you.
All right, so we'll take you across to the reading rooms. It's a short walk to the neuroradiology reading room. So welcome. Most of neuro MR is read throughout the day and in the evening, 24 hours a day. Someone is always staffing this reading room. We have some of our trainees here. Hey Nicole.
Hi.
How are you doing? What are you up to?
Just reading some MRs.
Nice. And you were a resident here. What made you want to stay for fellowship?
Well, I knew I have members and new faculty members. Everybody's very supportive,
Great.
knowledgeable, wonderful.
Dr. Kuda, how are you doing? One of our faculty members.
Hey, everyone.
Radiology ninja. So what are you doing here?
I'm doing a brain perfusion. Patient had surgery, and so sometimes we do that to see if there's any changes that give us a clue if there's tumor coming back or not.
And how long have you been at Yale?
Been here. I did fellowship here, and then I've been on faculty for about 3 years.
And what are you involved in? Locally, internationally, research-wise?
Locally, we do a lot for patient care, trying to develop some more advanced imaging, trying to use AI to kind of help with reading scans more efficiently imaging patients. On a more local or potentially national level, I'm also one of the communications officers, so we do patient-facing communications like Facebook, Twitter, and try to get the community educated as well. And I'm also on some of the national committees like ASNR, RSNA, and ASSR for the social media platforms.
Yeah, we see a lot of your cases on ASSR on Twitter.
Okay. Thank you for following.
Great. What's the best thing that's about being here at Yale for you?
Everyone's just very collegial, which is great. If I need help, when he's sitting in the room here, I can always pick his brain.
Hey,
and
Anthony.
always
One of
super
our
nice.
other
How's it going?
faculty members.
And there's a lot of resources here for research and just even developing education better. I know you guys have seen some like RSNA Live lectures I've given. That seems to be somewhat popular. People like to compete with each other, it seems. So it's just been a good experience here overall.
Anything else you want to add for the medical students, why they're here, or your interaction with some of the trainees?
Everyone that comes here seems to be very nice, collegial, and you guys are all super smart. We work together, which is great. So that's a real plus.
Dr. Karan, how are you?
Good, thanks.
Good. You're a fellow here.
I was a fellow here, this is my third year.
You started as an attending a year ago?
That's correct,
Yeah.
yeah.
How's it been so far?
It's been great, actually, yeah. It's like, it's a really great environment to like learn and to get training at. It's like, we try always to like improve things from the training standpoint, always modifying things in a better way, just to make sure that residents and fellows are getting good feedback, getting good teaching, good education. That's what we try to do. Now, I'm trying to help out Dr. Zucconi in the program, in the neuroradiology program, just to improve things and get things better.
Wonderful. Thank you so much. Dr. Langton? Dr. Langton, one of our residents, he's on the Holman Pathway Research Track.
That's right, yes.
So how's it been so far in neuro, and maybe you can talk a little bit about Holman Pathway?
Oh, well, this is like my second day on neuro, but I'm loving it. I think neuro is absolutely great. As far as like the Holman pathway, it was an opportunity to take some of your residency training and use it for research to get more of like a more in-depth academic experience. It's like a split time between doing your research and doing your clinicals, and I think it's an excellent opportunity given all the research opportunities that are at Yale. So when I was thinking about it, I was like, I've got this opportunity to really work in artificial intelligence and really work with some of the best people in the world as far as artificial intelligence applications to radiology are concerned. And I thought it would be an excellent opportunity, and it absolutely has been. So,
And you've been getting dedicated time off in your work with the chief residents to
yes, to kind of negotiate dedicated research time. So I have some protected time to really get some really in-depth training in AI. Yeah.
Thank you.
Great.
Alright, let's get back to it. So you have it. This is just a typical reading room here for neuroradiology. This is my cancer center. We have another reading room for neuro in this campus that we'll be showing you as well. We left off at the neuro MR reading room in Smilo. Most of our CT during 8 to 5 is read here in the Fitkin building. So we'll walk over here into the CT and plain film reading room for neuroradiology. Neuroradiology reading room. Hey guys. How's it going? Good. Always introduce yourselves. What are you doing in case you're reading?
Sure. Hi, my name's Joe. I'm one of the R1s. Looking at a case of CT angiogram right now. I was just barely looking at a case of diffuse idiopathic skeletal hyperostosis. What else do you want to know?
Yeah. So it's been a few months, right?
Yeah.
Here at Yale.
2 months.
2 months.
2 months.
How's the transition been, and how's it been like being at Yale?
Loved it. Absolutely loved it. Yale's been phenomenal. I came from UPMC and started with musculoskeletal and with ultrasound scanning, and now I'm neuro. Almost done with neuro, and then moving on to body. Anything else you want? Okay, so that's good.
You're one of our senior residents.
My name is Bilal. I'm one of the fourth years. Right now I'm looking at this CT of the soft tissue neck for a patient with head and neck cancer. This is my second week on the service. and it's been pretty good so far.
What's the best thing about being here at Yale so far?
It's everything, but mainly what stands out really is the diversity and the variety of cases as well that we see. We really have no one kind of category of cases that we're not exposed to. We have from trauma cases to head and neck, to cancer cases to very advanced, very basic bread and butter. It's a really good mixture of things.
All right. Over to one of our newest attendants. Introduce yourself.
Hello, I'm Sandra. I'm one of the new attendings in Neuroradiology.
Can you tell us a little bit of your background? You're a fellow here. What made you want to stay?
Yeah, I was a fellow last year. Everything about Yale made me want to stay. So like the collegial atmosphere here, everyone is extremely nice, and there's like a lot of diversity. They embrace diversity. I'm originally like from Lebanon, and I did my fellowship here. I fell in love with the program and the institution, so I really want to stay, and I'm glad I got to stay. So.
And you presented a lot of national meetings and research. You talk about from the training side how that's been in terms of mentorship and research.
Yeah, I've like had a lot of opportunities to work on research projects, and I presented at a lot of meetings. Like last year, we've been to the ASSR, American Society of Spine Radiology, and they had the research projects presented there. ASNR, we had to do it online and virtually, but we also had the chance to present and like win some of the prizes. So there's a lot of opportunity for research and for growth, even like during 1 year of fellowship.
Any other things you want to mention?
I just like wish everyone good luck, and it would be really nice to get into this program and institution.
Yeah. Thank you.
Sure, thank you.
One of our other attendings.
Hi.
How are you doing?
Good. How are you?
Not too bad. Not too bad. Can you tell us a little bit about your background and how you got to Yale?
Sure. So, I did my medical school in Tehran University. Went to Boston, Mass General. Did years of research fellowship. From there to University of Minnesota for residency, and then UCSF for fellowship, and then after doing a year of clinical instructor there, I joined Yale 2018. And so far it has been really a good experience. I've got the opportunity to work with fantastic, residents and fellows here, and truly enjoying it.
You've been involved in a lot of research. You recently gave the NIH grant rounds. Can you talk a little bit about the cutting edge research you're doing here?
Sure. So I was actually looking into a research-oriented career. So when I was a fellow, I applied for the RSNA grant. I got a RSNA fellow grant, and then after my move to Yale, I got RSNA seed grant, and then Doris Duke Award as well. My research in recent years have focused on application of AI and machine learning. I have also worked on brain connectomics in children with neurodevelopmental disease and autism specifically. I also have interest in brain cancer as well as head and neck cancer. This is a great institute in terms of having the infrastructure and the research setup to, for those who are interested in, pursuing a, academic career at whatever level, whether it's like residents or fellows. We have great residents and fellows who are all involved in research. So if this is something that anybody is interested in, there is definitely great opportunities here.
You recently published in Stroke with one of the junior chief residents.
Yeah. So
congratulations.
Thank you. So yeah, we have two of our current residents, are Khalid and Ali, are actually involved in they're working with people in my lab. We also had the former chief resident Kim Seifert, who worked with us, and she's now in Stanford for her fellowship. So yes, whoever is interested, there are like tons of opportunities. either with me or other people in our section or other sections. So yeah, it's been a great experience.
What's the best thing so far been here about being at Yale?
I think just this is a great place for people who are pursuing like different aspects in radiology. Definitely the volume of the cases and the diversity of the pathologies that you see here is a great experience for becoming a radiologist. We do have great opportunities for those who are seeking into like a healthcare policy or administrative. With the work that with the close connections that our especially emergency department has with the Yale School of Health, Public Health, as well as like a business school. If you're interested in pursuing a career in research, there is like definitely great opportunities here. And then for those who are interested in like an education career, we also have like fantastic tracks that can guide you toward becoming a great educator. So whatever you pursue, whether it's like a private practice, becoming a healthcare leader, or good educator or researcher, there are definitely those paths here. So I think that's the best thing about this program.
Thank you so much for your
Thank you.
time.
Yeah, it was great. Always great seeing you.
Likewise.
All right.
Right, so there you have it. This is the Neuro-CT reading room. We had some of the residents and some of the attendings as well. And we'll also feature some of the other members of the Neuroradiology department as well shortly.